Hi, I'm Felicity, registered nurse, cosmetic injector and clinic owner. Welcome to my channel, The Fit Injector. Today is episode 14 of the Gift of Healthy Skin series, and our topic is, what is rosacea and how do I treat it? So rosacea is a skin condition that causes redness, flushing and red pus-filled bumps exclusively on the face. It can affect anyone, but it's most commonly occurring in middle-aged women with fair skin. What are the symptoms of rosacea? So, pimple-like breakouts with no blackheads, redness to the center of the face, so the inner cheeks, the nose, the forehead and the chin, large pores and visible blood vessels. The eyes can also be affected, causing issues such as bloodshot eyes, dryness, puffiness, redness and swelling of the eyelids. The skin can also be itchy and sensitive to skin products, and in late stages of rosacea, the nose can actually enlarge and become bulbous. The cause of rosacea is actually unknown and there's unfortunately no cure. Rosacea could, however, be the result of an immune system issue, genetics and environmental factors. So what are the treatment options? Treatment for rosacea is all about the management of symptoms, and it is important to start treating as early as possible, as if it's left untreated, it will get worse over time. At home, some things you can do to improve the appearance and symptoms are using a sunscreen and a daily moisturizer and a gentle cleanser. Avoiding products which will cause aggravation, such as strong actives and scrubs. Use eye drops if you're experiencing dry or irritated eyes, plus avoiding known triggers such as sunlight, spicy foods, alcohol, hot drinks, stress and overheating, especially in bed at night. So when should you seek professional assistance? Well, it's important to have rosacea diagnosed and to rule out other similar skin conditions. Your GP can assess and prescribe antibiotic, topical creams or tablets, or you may be referred to a dermatologist for further assessment and treatment, such as laser-based treatments. So what can I do for you in clinic? Well, during a consultation, I may discuss rosacea with you if you're describing these symptoms, and I will refer you to have a diagnosis with your GP or dermatologist. From there, I can assist you with LED light therapy, which is suitable due to its non-invasive nature. I can also assist by reviewing your current skincare routine. Thank you for watching this video on rosacea. I hope this has helped, particularly if you have been experiencing symptoms, but you weren't really sure what could be the cause. Drop any comments or questions below. Give me a thumbs up if you enjoyed this, and don't forget to subscribe for more. See you tomorrow.